The cost of seeing a doctor looks set to increase, prompting concerns about access to affordable healthcare. But the federal government insists any change would have little impact, with the number of doctors who bulk bill their patients higher than ever.
Less than 20 minutes with a GP could soon set patients back $78.
Take a nice big deep breath.
The Australian Medical Association has recommended doctors increase the cost of a standard visit by $2, a rise that won't be reflected in the Medicare rebate because the federal government has frozen it at the 2014 level of just over $37.
Every day the freeze remains in place is another day that patients are paying more out of pocket for their medical services.
Some people are putting off seeing the GP because they can't afford it, and that's obviously a huge concern to the Health Consumers Council.
Their health is not going to improve out of nowhere. They are going to end up in the hospital environment. They are going to the emergency department, and that's going to cost the Commonwealth and the taxpayer even more.
Bulk billed patients won't foot the bill, and the government says they make up the majority.
What I focus on is the bulk billing rate, and it has never been higher. It is, for GPs, 85.1% of all consultations in Australia last year.
But doctors say they may be forced to abandon bulk billing to keep their business running.
The problem is that the costs of running a practice keep going up well above the rate of inflation. Things like electricity, wages.
The body representing GPs has met with government and says it was productive.
The Prime Minister and the Minister for Health clearly said in the meeting that the moment the budget would allow us to lift the Medicare rebate freeze, they would certainly consider it.
The Medicare rebate was expected to remain at the current level until at least 2020. Courtney Bembridge, ABC News.